Hi, my name is Bilal Alkhaffaf. I'm a bariatric weight loss surgeon based in Manchester with over 2 decades of surgical experience, more than 10 of which have been as a consultant. Each year, my team and I have the privilege to help hundreds of men and women who struggle with their weight and are desperate for help with a problem that affects every aspect of their waking day. If you're watching this video, we'll soon be speaking about different weight loss treatments during our first consultation. This presentation aims to give you a brief overview of the key considerations related to weight loss treatments. It will help you put together a list of questions to ask me and allow us to have a more meaningful conversation about which procedure may be most appropriate for you. This video will also act as a reference for you to go back to afterwards to support your decision making. The contents of this video provide key principles and consideration which aim to support informed decision making. However, everyone has a unique set of circumstances and medical background which may influence which options are most appropriate. So please treat this information as an introduction, and we will tailor a management plan which is specifically focused on your circumstances during our consultation. I'd like to focus on 2 areas during this video. Firstly, we'll spend a little time understanding obesity and exploring how it develops. A better understanding of obesity will then set the scene to introduce the different well-established treatments, which for most people result in unparalleled, sustained weight loss and reversal of weight-related medical conditions. Obesity is the excessive accumulation of fat which, importantly, poses a risk to health. It's a chronic, complex and relapsing condition, often affecting people for long periods of their life. In other words, it simply doesn't develop overnight. Many factors contribute to it, and even if you lose a significant amount of weight at one point, it is possible for weight regain to occur. From a medical perspective, we often use the term BMI or body mass index to define obesity. BMI considers a person's weight in relation to their height, with a normal BMI being between 18.5 and 25 kg per metre squared. A person is defined as having obesity if their BMI is greater than 30 kg per metre squared, because it's at this point that the risk of weight-related medical conditions increases significantly. Obesity is strongly linked to more than 200 medical conditions, many of which result in a poorer quality of life, negative impacts on physical and mental health, and a shorter life expectancy. Some of these include diabetes, heart disease, stroke, high blood pressure, liver disease, cancer, and infertility. We also know that carrying excess fat in and of itself causes serious consequences on mobility and joint health, particularly the lower back, hips, and knees, and it's also linked to serious breathing problems such as obstructive sleep apnea. Impacts of obesity can also be felt from a social perspective. People living with obesity are more likely to be discriminated against and stigmatized, and less likely to be offered employment opportunities. We also know that obesity doesn't affect everyone equally. Obesity seems to be more common in people from deprived areas, older age groups, some Black and ethnic minority groups, and people with disabilities. Obesity is therefore a condition which affects individuals and wider society and must be taken seriously. To understand how it develops, it's important to appreciate some basic concepts with respect to how energy is used and stored in the body. The human body needs energy, which it gets from food and drink, to perform tasks such as basic metabolism, digestion of food, normal daily activities, and of course exercise. Up to a certain point, we know that if more energy than we need is consumed, the body stores it as fat, which leads to weight gain. The opposite is also true, that if we consume less energy than we need, the body burns energy stored in fat and weight loss occurs. However, research in this area suggests that in normal circumstances, the body can control the amount of fat it stores. This system works to maintain a set point or a preferred weight range and will fight off attempts to change this significantly. This survival mechanism mirrors many of the other systems that the body uses to keep us healthy and in balance, and ensures that we don't lose or gain too much weight. When we increase fat storage, the body responds by reducing hunger levels and increasing the metabolic rate, resulting in weight loss. The opposite is also true, that when we lose weight, the body increases hunger levels and reduces the metabolic rate, resulting in weight gain. This can be compared to a heating thermostat. When the temperature drops too low, the heating system switches on, and when the temperature becomes too high, the heating system switches off to maintain the correct temperature. If you consider that throughout human history, up until 50 years ago, food was difficult to come by, you can begin to understand the importance of such a protective mechanism to human survival. But if there's a system against significant weight change, why does obesity occur? Well, in short, research suggests that several factors combine to create a perfect storm which overrides this mechanism. In other words, the body system can only really withstand a certain amount of stress and pressure before breaking down. Over time, this leads to the body working to maintain a higher and higher set point weight range, making it more and more difficult to lose a significant amount of weight through lifestyle modifications alone. There's no single cause for obesity, and often when we explore the background of someone living with obesity, we find several factors that may play a part. These may be modifiable, meaning they can be changed, but sometimes factors may be more difficult to change. Other causes may be related to the individual or the environment around us. Usually, the causes are a complex combination of all four. Some of the common factors that are linked to obesity include, of course, diet and nutrition. There's well-established research which details how our dietary behaviours can result in weight gain. Not only do we have to consider the amounts of food and drink consumed, but close attention should also be paid to the timing of meals as well as the type of food choices we make. Our eating behaviours are also influenced by our feelings and emotions. We eat when we're hungry, but also when we're celebrating, sad, stressed, bored and tired. And often our food choices in these circumstances are not good ones. Dieting or significant calorie restriction diets can also have a negative impact on weight in the longer term. Reducing your calorie intake significantly results in a slowing down in metabolism, increased hunger, and ironically, can result in you putting on more weight than you started off with. Over the last few decades, we've seen significant reductions in the amount people move. We drive to work where we sit at a desk, drive back home and then sit in front of the TV eating dinner. This, of course, leads us to storing more of the energy that we consume rather than burning it off. Certain medical conditions such as underactive thyroid and polycystic ovary syndrome affect the body's hormones and are directly linked to weight gain and the inability to lose weight as well. Mental health disorders such as depression and anxiety, in addition to neurodiversity, are also linked to weight gain. But so are many medications which are ironically often used to treat weight-related medical conditions. These include insulin and other anti-diabetic medications, blood pressure tablets, painkillers, steroids, certain antidepressants, antipsychotics, some antiepileptics, the oral contraceptive pill, and antihistamines. All of these can contribute to weight gain and obesity through a variety of different mechanisms. Our genetic makeup heavily influences our body's response to our behaviours and environment. We all know people who can eat and drink what they want and not put on any weight, whilst your response to the same foods is to put on significant amounts of weight. Lots of other biological factors influence our bodies as well, and are also strongly associated with obesity. These include increasing age, the menopause, pregnancy, and disordered sleep. Stress and interpersonal conflict, whether at home or at work, is also another common feature that I see in patients, which is linked to obesity. And finally, we can't ignore the social and economic factors that play a part in weight gain and obesity as well. Obesity is higher in deprived areas, processed foods are cheaper and more convenient to come by, and of course, we are all affected by the constant advertising which influences our decision making. I hope you've been able to understand that obesity develops because of a complex combination of factors and not as a choice or down to a lack of willpower. This helps us understand that tackling obesity usually requires a sophisticated approach to address several contributory factors. So now let's turn our attention to the different treatments for obesity and understand how they work. Treatments for obesity result in unparalleled weight loss and allow people to take back control. However, they also improve and in many cases completely reverse weight-related medical conditions. In other words, these treatments are as much about health gain as they are about weight loss. It's important to understand that treatments such as surgery don't cure obesity. Obesity is a long-term condition that requires long-term tools and strategies to control it. Treatments are not an easy way out and must be combined with a commitment to lifestyle changes such as improved nutrition, increased levels of physical activity, and any other factors that may have contributed to weight gain in the first place must be addressed. This is why it's essential that the process is supported by a comprehensive team of experienced healthcare professionals, which include doctors, nurses, dietitians, physiotherapists, and psychologists. Treatments usually exert their greatest weight loss effect in the first 12 months. This results in an improved motivation to adopt healthy lifestyle choices, which then must be maintained to sustain longer-term weight loss once these powerful effects of treatments begin to wear off. Finally, one size does not fit all. When we discuss the various options available to you, we will also discuss recommendations based on your particular set of circumstances, health conditions, and personal goals. Surgery may not be an appropriate option for everyone, or it may be necessary to postpone treatment until other health conditions are optimized. Ensuring that treatment options are individualized and tailored will give you the best chances of controlling your weight and associated conditions in the longer term. Most people will probably be aware that there are criteria which must be met to be considered for these treatments. These guidelines are in place to make sure that patients benefit from treatments and risks are minimized. More recently, we've seen a change to the guidelines which gives access to these treatments for patients at a lower BMI than before. In short, if you have a BMI of greater than 30 kilograms per meter squared, weight loss surgery may be an appropriate option for you. When we discuss options during our consultation, it's really important to be comprehensive so that you're able to make an informed decision. The first option is always that you do nothing. That will, of course, avoid the small risks associated with treatments, but of course there are real risks of doing nothing, as we've already covered, and these include the development of weight-related medical conditions, impacts on mental health, quality of life, and reduced life expectancy. Beyond that, treatments can largely be grouped under medications, endoscopic non-surgical procedures, and of course surgery. Medical weight management involves weight loss supervised by trained medical professionals with the additional benefit of prescribed medications. This field has developed significantly over the last few years, and more people are considering this as a first step. The weight loss results are modest, however, and there is the added issue of side effects and of course ongoing costs of medication. The gastric balloon is a temporary device which sits in the stomach and works by making you feel full. The silicone balloon is filled with fluid and is placed in the stomach using a gastroscope, or with certain options can now even be introduced in the outpatient clinic. It's then removed 6 or 12 months later, or in some cases dissolves on its own and doesn't require removal. The balloon avoids a general anaesthetic and you can go home on the same day. Most people feel well enough to get back to work within a couple of days of the procedure after the discomfort and nausea dies down. On average, people undergoing this type of procedure will lose between 1.5 and 2 stone by 6 or 12 months. Because the balloon is temporary, it's especially important for you to adopt healthy lifestyle choices to maintain weight loss in the future. People often choose the balloon because it avoids the small risks of surgery and is temporary. On the other hand, the balloon may not be appropriate if you have reflux, a hiatus hernia, problems with your esophagus, or if you have a lot of weight to lose. The gastric band is a silicone device which is placed around the top of the stomach. It can be adjusted by a specialist through a small port which is placed deep to the skin and is connected to the band by a long tube. The band works by sending signals to the brain which makes it think that the stomach is full. The gastric band is inserted using keyhole surgery and requires a general anaesthetic, so you're fast asleep during the procedure. On average, it takes between 40 minutes to an hour to complete. Most people can be discharged home the day after surgery, and physical recovery usually takes between 10 days to 2 weeks. Importantly, regular adjustments of the band are required in the first 6 to 12 months after surgery. On average, people undergoing this type of surgery lose half of the extra weight they are carrying by around 12 months. People often choose the band because it is a relatively straightforward operation to undertake and it's potentially reversible. If you have acid heartburn or reflux, have other conditions which affect the esophagus, or if your body mass index is particularly high, the band may not be a good choice. We also know that the band is not as effective as other options, and there are high rates of revision due to problems in the medium to long term. The sleeve gastrectomy or gastric sleeve is a permanent procedure which involves removing up to 80% of the stomach, leaving you with a long, narrow stomach the shape of a banana. It works in 3 ways. Firstly, because your stomach is smaller, your portion sizes are reduced and you feel fuller quicker. Your appetite is reduced because the part of the stomach which is removed produces the hormone responsible for hunger. And we also know that there are physiological changes which result in an increased metabolism. The sleeve gastrectomy is carried out using keyhole surgery and requires a general anaesthetic, so you are fast asleep during your procedure. It takes on average between 30 minutes to an hour to complete. Most people can be discharged home the day after surgery, and physical recovery usually takes between 10 days to 2 weeks. On average, people undergoing this type of surgery lose 3/4 of the extra weight that they're carrying by about 12 months. Current guidelines require you to take supplements for life. People often choose a sleeve because it is a relatively straightforward operation to undertake and it results in significant and sustainable weight loss. It has fewer short and longer term issues than we sometimes see with other options, including the gastric bypass. If you have acid heartburn or reflux, or if you have other conditions which affect the food pipe or esophagus, the sleeve gastrectomy may not be a good choice. The gastric bypass is a permanent procedure which involves making a small pouch from the top of the stomach. The intestine is then joined up to the new stomach pouch so that food and drink bypasses the rest of the stomach and the first part of the small intestine. It works in 3 ways. Firstly, because your stomach is smaller, your portion sizes are reduced and you feel fuller quicker. Your appetite is reduced, and we also see physiological changes that result in an increased metabolism. The gastric bypass is carried out using keyhole surgery and requires a general anaesthetic, so you're fast asleep during your procedure. On average, it takes between 1 to 2 hours to complete. There are 2 types of gastric bypass. The full Roux-en-Y gastric bypass involves making 2 surgical joins, and the mini gastric bypass, also known as the single anastomosis gastric bypass to give it its full name, is technically less challenging, needing only 1 surgical join. Most people can be discharged home the day after surgery, and physical recovery usually takes between 10 days to 2 weeks. On average, people undergoing this type of surgery lose 80% of the extra weight they're carrying by about 12 months. Current guidelines require you to take supplements for life. People often choose the full gastric bypass because it's the most established bariatric surgery available, We've been doing it for well over 50 years now, and it results in the greatest and most sustainable weight loss results of all the surgical options. It's also more effective against conditions such as diabetes and acid heartburn or reflux compared to the other options available. If you've had a significant operation on your abdomen before, then the bypass may not be the right choice for you. And we also know that the gastric bypass is associated with a higher chance of developing nutritional deficiencies compared to other options, such as the gastric sleeve. Revision surgery is the term used for any additional operation which is needed after a first-time weight loss procedure. There are several reasons why it may be necessary or appropriate to consider revision surgery. The commonest reasons include to correct surgical complications, both in the immediate period after surgery and in the longer term, to address medical complications which may develop in the medium to longer term, or to partly address inadequate weight loss or weight regain. The rates of revision surgery differ depending on the original procedure which was undertaken. For example, the need for revision surgery after gastric band is significantly higher than the gastric sleeve or the gastric bypass. Revision surgery is a complex area that needs careful workup and investigation by an experienced team who have taken the time to identify the specific problems that need addressing. Quite often, more surgery is not the solution to most challenges which may arise following bariatric surgery. However, in those cases where it is deemed appropriate, revision surgery is safe and can be effective. Without doubt, bariatric surgery is currently the most powerful medical treatment available that results in long-term and sustainable weight loss. Nonetheless, this is surgery and we need to respect the fact that there are some small risks with it. Each of the different procedures has its own rate of complications, which we will cover when we meet. The complication I often get asked about is the risk of dying as a result of surgery. This is thankfully extremely rare and may happen in less than 1 in 2,000 cases. As a comparison, this is significantly lower than the risk from gallbladder or hip replacement surgery. In the case of sleeve gastrectomy or gastric bypass surgery, the risk of the staple lines or surgical joints not healing, which we call a leak, occurs in less than 1 in 100 cases. If this happens, further treatment is normally required, which means readmission to hospital and more surgery or procedures. Finally, the need for further treatment to fix a problem which has occurred as a result of surgery occurs in less than 5% of cases. However, the risk of this is much higher in the case of the gastric band. Most people come into hospital, have their surgery, and can be discharged the following day. You'll be given pain relief and other medications, and of course, you'll be heavily supported by the team whilst you get back on your feet. Most people will need to take a couple of weeks off work, and if you need one, we'll provide you with a sick note that doesn't go into any details about the type of surgery you have undergone. If you have specific questions about your recovery, we can cover these further during your consultation. So in summary, obesity is not a choice. It is a complex, chronic condition caused by many different factors. The treatment of obesity is very much geared to improving health, and this is not cosmetic surgery. Treating obesity must also include addressing the underlying causes of obesity, which are different for everyone. And finally, treatments such as surgery are extremely safe, highly effective, and result in unparalleled weight loss. I hope you found this video useful, and I look forward to meeting you during our consultation. Until then, take care.